The coronavirus has led to a significant interruption for mental health service in 93 countries globally. The reason is that state focuses fully in eliminating the novel virus while neglecting psychological disorders. The demand for mental health is escalating greatly as the world's attention lies on how to defeat COVID-19. Ibrahim John reports.
A survey conducted between June and August 2020 in 130 countries revealed the first global data portraying the dreadful effect of COVID-19 on attaining mental health services. There stated an urgent need for an increment in funding to tackle the rise in cases of mental health during the period of the pandemic. Survey questionnaires focus on evaluating the existing and funding of mental and psychosocial support plans as part of the response plan to COVID-19. Ahead of WHO's October 10th mental health event in which world leaders, celebrities and advocates are to take part, Dr. Devorah Kestel, director of the WHO's Mental Health and Substance Use, said that it is paramount for countries to rightfully invest in the mental health plans to respond to the population's psychiatric needs.
It is important then that countries ensure proper investment to the mental health and psychosocial plans that are already available in order to make services ready to answer to the need of the population. It may be through establishing the basic services following the guidelines that we have already made available. It may be by implementing alternative services if the traditional ones are not possible due to the safe measures needed. The increase in funding is very important right now.
Dr. Kestel called upon governments the world over to aggrandize the care for people battling mental, neurological and substance use disorders.
We know that there are direct and indirect consequences of the COVID-19 in the mental health of the population of countries affected by the pandemic, and we expect the demand to increase for care of people with mental, neurological and substance use disorders. We are then concerned that services should be available to answer to the needs of those people.
Loss of employment, isolation, the death of close relatives in the COVID-19 period triggered mental health conditions and aggravated existing ones. Many people have increased their alcohol consumption and drug use as the world ventures into lockdowns to halt the spread of COVID-19. Reporting for iAfrica News, I am Ibrahim John.
More attention needed for mental health patients as the number of mental health patients escalate.